Hi, I'm Dr. Bhargav Rao from Pathofast Lab Pune. Today I'm going to explain to you the reasons for having a positive pregnancy test but then you begin to have your periods or you notice bleeding. You might be confused or concerned or worried about this, and I'm going to give you the simple list of causes and what you should do. The first thing you have to remember is that a false positive pregnancy test or an error while doing the pregnancy test itself may be the cause for this. Maybe you're not really pregnant and your pregnancy test is not even positive, but because of some mistake, this has come out as positive, and now what you're having is your normal period, and so you're confused. The next possibility is that this is just normal bleeding or spotting that happens even during pregnancy. Almost 27 or 30% of women do experience some amount of normal bleeding during pregnancy, and this may not even be a cause of concern. The third possible thing, which is obviously very much more serious, is that this could be a miscarriage, or it could be also a herald of miscarriage that may happen later on. And lastly, it could also be happening because of a couple or some medications that you're taking, maybe because you're trying to get pregnant to improve your fertility. So these are the possible reasons. I'm going to go into each of them now in detail. The first thing that we have to be sure about is that this wasn't a false positive pregnancy report that you had. So if you have gone in for a pregnancy blood test, you should know that there are situations where a false positive report may come out. This can be because of some things like cancers. It could be because of autoimmune diseases, which are rare diseases in which there are certain substances present in your blood that can react with the chemicals used while doing the test itself. And it could also be because of a variety of other reasons, like maybe you're taking certain medications, even that can cause it. There could have been an error during the time of performing the test. Maybe the machine wasn't working properly. Maybe it wasn't calibrated in the right way. Maybe something else went wrong. Maybe the sample tube was contaminated. There are hundreds of different reasons because of which you could have a false positive pregnancy test report from a given lab. So what we need to do first of all is that we need to make sure that you really have a positive pregnancy test report, and so you should get your pregnancy blood test repeated from another lab, which is preferably using a different technique or technology to measure the results. If you on the other hand had done a home urine test for pregnancy, a dipstick test or a strip test, where you just added a couple of drops of your urine to the test kit and it came out as positive, these are not completely reliable. There are many reasons because of which they could give you false positive results. In such a situation, the best thing to do is to go to a lab and get a pregnancy blood test done. If that is also positive, then you can at least be sure that yes, you definitely are pregnant, and then we can look at other causes. Before exploring the other causes of this situation, we need to know what kind of bleeding you're having. Is it just light spotting or light bleeding? By light or spotting or bleeding, I mean when you normally have your periods, that's what we call heavy flow. So is whatever you're noticing less than what you would normally have when you're having your periods? If yes, then you probably don't have to be too worried about it. Light spotting or light flow happens in normal. It even happens normally during pregnancy, and it's usually not a cause for concern. But if the flow is heavy, just like when you have your periods, and or it is accompanied with pain or cramps, then yes, this can definitely be serious. It is usually considered to be a sign that something is not going right with the pregnancy, and you shouldn't ignore it. It has been proven through research that women who have heavy pain and heavy flow during the initial part of the pregnancy may tend to have complications, including miscarriage. So this is the next thing that you need to ask yourself. You need to characterize the type of bleeding before I explain to you the rest of the causes. One of the possibilities that we have to think about when you have heavy bleeding or bleeding during a pregnancy is a miscarriage. Heavy bleeding sometimes could mean a miscarriage itself, where it is basically means that the pregnancy is lost or it's a failed pregnancy. But heavy bleeding is also associated, even if it currently doesn't mean that you're having a miscarriage right now. Research has shown that heavy bleeding in the initial parts of the pregnancy is associated with miscarriage later on down the line. So heavy bleeding could be a sign of miscarriage. It could also be seen when the pregnancy takes place in a place which is not in the normal part of your uterus, but somewhere else. This could be maybe in one of your fallopian tubes. This is called an ectopic pregnancy, and it's a dangerous situation because it can burst. So these are some serious situations in which you might be having the bleeding, miscarriage or a failed pregnancy being one of them. So your future pregnancy chances are good. It is also possible that your doctor, once you have consulted them, will even be able to solve the current situation, whatever it is, Maybe it's just a minor problem, maybe it's because of some medicines that you're taking, and your doctor will be able to solve it. It doesn't mean that you won't be able to get pregnant in the future, so you don't have to panic or worry, but definitely consult your obstetrician. That's the best thing that you can do. Get your pregnancy test repeated from another lab, and ask your obstetrician about what are the best next steps that you should take.